would like to start our event today with a cultural blessing, as it is part of our protocol. E lau malie hifo mai, ki ho mau faleni. Haele mo mafi, a iwi ho o keresi. Tō hifo o hangi hahahau, ki ho mau atamai. O ngahi ko e kere tau, ai funga makani. May the spirit and blessings of this gathering envelop you today. May our collective hands make fertile soil of this work. Thank you for being with us today. Dua o fatu. The director of our UCLA Center for Health Policy Research, Dr. Ninez Ponce, will be providing our opening remarks, and she's joining us via phone due to some technical difficulties.
Thank you. Thank you so much, Alici, for opening up today with a cultural blessing. Good afternoon. As a land-grant institution, we would first like to acknowledge the Gabrielino Tongva peoples as the traditional land caretakers of Tovangar, that is the Los Angeles Basin and South Channel Islands. My name is Ninez Ponce, and I'm the director of the UCLA Center for Health Policy Research and professor and chair of the Department of Health Policy and Management at the UCLA Fielding School of Public Health. Welcome to today's webinar, and I apologize due to technical difficulties. I may be joining you imminently by web, but I want to make sure that we start the program and have enough time so that you can hear about the wonderful developments that the lab has done. So today's webinar is Data Within Reach, centering the NHPI community. We know that communities often come together in remarkable ways when faced with tragedy or crisis. So when the COVID-19 pandemic began to reveal long-standing systemic, social, and health inequities facing members of racialized and minoritized groups, the Native Hawaiian and Pacific Islander communities jumped into action. At the time, COVID-19 case and death rates were higher for NHPI communities than any other major race or ethnic groups in most of the states that disaggregated Native Hawaiian and Pacific Islander data. However, the data were so limited that despite federal mandates, most states weren't reporting NHPI specific data, and the NHPI community had become overlooked. The COVID-19 pandemic further exposed gaps in data, but Native Hawaiians and Pacific Islanders have experienced decades of gaps and data inequities, even way before COVID. So through the support from NHPI leaders and community organizations, we have worked to change that. From initial phone calls and meetings with community leaders, notably the National Pacific Islander COVID-19 response team, to a small but assiduous, small and mighty group of NHPI scholars, the University of California researchers as well, and myself, volunteering to scrape COVID-19 data, to launching the NHPI Data Policy Lab and developing dashboards and data that are being shared far and wide. We have made strides over the last 3 years. And we wouldn't be here today without your support. I want to thank the NHPI community, organizations who have contributed their time, their knowledge, their passion, their care, from EPIC, from Empowering Pacific Islander Communities, to AAPI Data, to the Southern California Pacific Islander COVID-19 response team, and the more than 30 NHPI organizations who have partnered with us to make this possible. I also want to thank the Robert Wood Johnson Foundation, one of the lab's first funders, and particularly today to the Federal Office of Minority Health for believing in and supporting this work. These public and private, both local and national funders and partners have recognized the value of the NHPI Data Policy Lab. The Data Lab is a growing source of data and a policy resource focused on the service of advancing the health and well-being of NHPI communities in California and nationwide. So today, we will launch a series of data dashboards aimed at providing accessible data tools on the health and health needs of the NHPI community. These dashboards were developed to address the community's barriers to accessing and utilizing disaggregated health and social determinants of health data to inform advocacy efforts and programs. And today, we'll hear from leaders of 2 community organizations on the importance of accessible NHPI data and building community interest in data and research. The webinar will also feature the NHPI's Addressing Health Equity and Data, or AHEAD project, supported by the Federal Office of Minority Health. Through this project, we have been working to improve and expand capacity for community organizations, government officials and agencies, local health departments, and foundations to harness data on NHPI's social determinants of health. We'll also discuss the development of a training curriculum to support the optimization of data literacy, data use, and data systems advocacy. If you're interested in today's slides, you can request them from our communications department at healthpolicy@ucla.edu. Now I'm excited to launch these new products and welcome Calvin Chang from the NHPI Data Policy Lab. And I'm also excited, I hope that I can join by video at some point, but Calvin?
Aloha mai kako. I'd like to first acknowledge the work of our elders that have been advocating for better data for our community for decades. Folks like Hardy Spore, Senator Akaka, and Esther Pia'aina, as well as champions who are no longer with us, like Kaylin Young and Uncle Victor Kaiui Pan. The work that we do at the lab would not have been possible without their guidance. Next slide, please. Today, we're announcing the launch of 4 new dashboards from our lab. NHPIs have faced health inequities that have been perpetuated and exacerbated by the lack of data. We know that if we don't exist in the data, we often don't exist in the eyes of decision makers and those with resources. To that end, we've developed 4 new dashboards to assist communities and NHPI serving organizations that have had difficulty finding or accessing NHPI data. The first 2 dashboards feature social determinants of health data, one of which focuses on data at the state level, and the other on California county level data. The other 2 provide COVID-19 data. Unfortunately, it looks like the virus is unfortunately here to stay with us for at least the foreseeable future, but we hope that these dashboards will help us continue to track it, at least at the California county level and in the top 10 counties ranked by NHPI populations outside of California and Hawaii to get a broader view of how our community is faring. Next slide, please. The first dashboard I'll be sharing is the social determinants of health dashboard for NHPIs by state. These topics were chosen based on a community data needs assessment, and we decided to initially work with fairly large data sets that our NHPI communities were more likely to be well represented. As it currently stands, this dashboard features 27 data visualizations across 7 major topics. Next slide, please. Here we have a few screenshots from this dashboard. The topics are listed in a column on the far left, followed by states that can be individually selected. Once a topic and state has been chosen, the right side of the dashboard populates with available NHPI data. 2 visualizations I'd like to highlight from this dashboard are butterfly charts that allow us to compare the major OMB racial and ethnic groups, as well as the percentage of employed people that work in STEM and essential occupations. What these charts show is that there's an estimated 2.5% of NHPI women are employed in STEM occupations, as opposed to 9.3% for employed NHPI men. Both groups have far greater representation in essential occupations, which include healthcare practitioners, protective services, construction, and maintenance. Next slide, please. Our next dashboard also features social determinants of health data for NHPIs, but at the California County level. These topics and sources mirror those in the previous dashboard, since they were prioritized by the community during our town hall meetings and conversations with them. And although we largely used US Census Bureau data, we also had access to the California Health Interview Survey, which is the largest health interview survey at the state level in the entire United States that's run under the Center for Health Policy Research. We also wanted to highlight a study that was performed by Kaiser Permanente Northern California researchers. For this dashboard, we ended up creating 39 data visualizations across 7 major topics. Next slide, please. As you can see, the layout is substantially similar, and it's one in which we've received positive feedback with regard to its ease of use. Some highlights from this dashboard include some of the CHIS data that I mentioned, including asthma rates, and from the Kaiser study, heart disease diagnoses. What's interesting about the Kaiser study is that they also took care to disaggregate by Asian subgroups as well, which we know also suffer from data aggregation that can mask stark disparities between Asian groups. Next slide, please. Our third dashboard is the COVID-19 death dashboard by California, for California counties. This was originally conceived as including case and vaccine data, but we've recently developed some significant concerns regarding data quality for those data sets. But we still believe COVID-19 death data has the potential to show broader trends in our NHPI communities. For this dashboard, we created an interactive map and a set of data visualizations to complement it. Next slide, please. For this dashboard, users are instructed to hover their cursor over these diamonds, which represent counties that have reported at least one NHPI COVID-19 death. The larger the diamond, the higher the relative death count for that county. And the redder the diamond, the higher the relative death rate. We can see that LA County has the highest NHPI death count, but unfortunately San Bernardino and several other counties, including Orange County, actually have higher NHPI COVID-19 death rates. When the mouse cursor is hovering over one of these diamonds, it will automatically change the data on the right, to the right of the map to show the latest COVID death counts and death rates. And this is information that's pulled from the CDC's provisional death data sets. Next slide, please. This last dashboard represents the top 10 counties that I mentioned are ranked by NHPI population outside of California and Hawaii that also report COVID-19 disaggregated NHPI data to the CDC. For this, we chose miniature county maps with the idea that those from these counties would likely be able to would likely be able to recognize their county fairly quickly by looking at this array. And each county was placed as best we could relative to their position on the continental United States. Next slide, please. So we can see the 3 pages that make up the data visualizations for this dashboard. The line graph shows data going back to February 2020 and represents the cumulative case rate. The bar chart shows a comparison of the most recent death rates for that county as reported by the CDC. Over the next few slides, I'd like to share 3 important lessons that we learned during the course of developing these dashboards in the hope that they might be of use to other folks that are hoping to also develop visualizations that might be of use to our community as well. Next slide, please. So the first lesson is meet the community where they are at, or rather where we're at. For those who may not know who Frank Robinson is, he supported civil rights campaigns against segregation and also happened to be one of the best baseball players to ever play the game. I share this quote because a common theme that emerged from our conversations with community was that data was rarely accessible, but very much wanted. And even when it existed, it may not have been provided in a format or wasn't easily located in a way that they could access. Data tools were often also seen as quite complex. And this is problematic, not because NHPI community organizations are incapable of understanding these tools, but because our community has been chronically under-resourced for so long, and we are often overstretched. NHPI community organization staff must often deal with numerous roles that they play within relatively small organizations and manage multiple programs and multiple direct services that they have to supply to our communities on the ground, leaving very little time to set aside to learn how to use in-depth complex data tools. This is why it's important that the data tools that are developed, such as ours, at least try to meet the community where they're at. Next slide, please. So for our dashboards to address this, we streamline the interface and try to reduce the number of clicks necessary to find data. So that in our case, for the SDOH dashboards, only 2 clicks are necessary to show data. We also decided against using a drop-down menu, which may have made for a cleaner look, but would have hidden the topics and would have required more clicks and perhaps scrolling down through a menu in order to see whether or not a topic somebody might want to find is even in the dashboard. Next slide, please. The second lesson we learned was to show and tell. And we're often told that good narratives don't involve telling. However, for data dashboards, we found both to be equally important. Next slide, please. In terms of showing, we've tried to keep a variety of visualizations on our dashboards, and they're varied based on the type of data, the complexity of the data, but we understand that being able to visualize data gives people a perspective and allows for much more salient comparisons many times. Next slide, please. And in terms of telling, we didn't shy away from using lots of explanatory text wherever we felt it was necessary. Here we see examples of how disability has been defined by the Census Bureau, and links to additional information for occupations are provided. And there is a written explanation for the color and the size of the diamonds in the California County COVID-19 dashboard. And those are just a few examples of the texts that we thought would be most helpful for users that are trying to understand what these visualizations represent. Next slide, please. The third and last lesson refers to a frequent challenge that we heard from community organizations. It's difficult for our communities to be able to justify the funding that our communities need, the resources that our communities need, if we're constantly being overlooked, especially for lack of data or lack of accessible data. Next slide, please. What we hope our dashboards can accomplish is to highlight important issues as well as NHPI data. For example, on the SDOH dashboards, on the very first page, which is reserved for demographics data, at the very top of that page, we intentionally placed information on the distinction between the alone and alone or in combination categories, because our communities rarely get to define ourselves in data. And agencies and organizations will often use the single race category, which can end up leaving out half of our community. We can't afford to look this many of our community, unfortunately. And in terms of emphasizing what matters to our communities, we have also used color choice to draw the user's attention specifically to NHPI data. Next slide, please. Our next steps will involve maintaining community relationships, which are essential to ensure that our tools remain relevant and impactful. We also hope to strengthen our community's capacity to work with data through a data curriculum that Alisi will speak a bit more on. And last, we hope to be a resource for NHPI organizations advocating for equitable data. We've moved beyond simply asking for disaggregated category, especially if it means only getting asterisks or unstable data. What we ask for now is more granular, intersectional, and robust data that can grant us the type of insights that other communities have long been able to take for granted. Next slide, please. Thank you very much. That concludes my portion of this presentation. And next we have Alisi Tulua.
Thank you so much, Calvin. I hope that got you excited to hear the rest of our presentation. My name is Alisi Tulua, and I'm the project director at the NHPI Data Policy Lab. And my portion of the presentation today is to provide some insight to the processes that went into developing some of the data tools that Calvin has just shared about. And when I began to gather the information for my presentation, one of the things that came to mind was the process that we often go through, some of us, in making a lay. Usually when you make a lay, there's a purpose for it. And most of the time, it's usually for a graduation, a wedding, or even just a gift to say, I appreciate you for being here. So if this was in person, we would probably be presenting some of you with this gift. But instead today, we're presenting you with our data tools. These processes that are necessary to building, I'll speak to making a lay, is that you go through the same processes of collecting the materials that you need, figuring out the best formation for what you want your lay to present, oftentimes examining it for the best way that you want to arrange the flowers, maybe even asking other people for feedback. And then, of course, the last part is the presentation of it, which is what is bringing us here today. I want to acknowledge the members of the NHPI Data Policy Lab. And a part of our lab, our staff from the Center for Health Policy Research. I want to acknowledge Dr. A.J. Scheitler and the Director of Communications, Tiffany Lopes, and her team for making today possible. I want to acknowledge Dr. Brittany Morey, who's a assistant professor at UC Irvine, and the rest of our team, Karina Penaya, Carla Thomas, John Greer, Nicholas Pearson, Vanan Tran, Jessica Lee, our evaluator, Dr. Jacqueline Tran, and Jacob Rosales, and the data team. So many hands make this work easier. I want to make sure that I acknowledge those folks. And so as Ninez shared earlier, and also Calvin, there are two main projects that have helped us make these tools available. And four of the dashboards have been presented on today, but in combination, these two different projects have allowed us to develop several tools. Some of them, one of them we launched last November and is made available today, the Data Policy Platform. But as you can see, we have had a great honor as part of the lab to make tools available to our NHPI community and those that are working with our data. I will be going through the process of explaining one of the key processes that helped to develop the NHPI Social Determinants of Health California County Level Dashboard, which is part of our project that is funded by the Federal Office of Minority Health. And this project is called NHPIs Ahead. This project started with a community needs assessment. As you may very well know already, having the community engaged in the process is of top priority to our process and our work. And so we started with a community needs assessment, really examining two key questions. What kind of data does our community need? And what kind of technical trainings do they need to build skills that would be useful for them in accessing data? In that process, we invited 57 California NHPI serving organizations, and 34 of those organizations completed our needs assessment. 2 of those organizations are represented today in our community speakers, and I hope you stay around for that process. But these are some of the key questions that we looked at in our needs assessment. We wanted to see the kind of characteristics that our organizations have, their capacity for accessing data, what they feel are the barriers to accessing data that they need. And of course, one big question is, what kind of data do you need? What would you use the data for when it is available? And what kind of skills do you need? Following the needs assessment, of course, is our analysis process. And to sum it up, there was a lot of great data gathered here. Notably, there were 30 data topics that were put forth and selected for by our community organizations, but these are the top 10 that I pulled from those topics. And of course, there were some other data topics that was presented by the community that wasn't necessarily explicitly stated in our assessment. So you can see that there's a lot of information that our organizations need and need the data for. Following that process, we presented back the information that we captured from the needs assessment. And this is a very important process to continue to build relationship with the organizations, and also just our responsibility and accountability to make sure that whatever information we gather, we also give back to the community. Following the community report back, we went back and looked at the findings and started to work on how we can get data that can help us build the dashboards. This is an example of one of the processes we went through. We took all the topics that our community said they wanted data in. And one of the questions that we asked is whether they know any data sources for those topics, and community organizations provided some of that. But it was upon us at the lab to look into data that might be available to us, that might not be available to the community, to help us figure out what data we need to build into the dashboard. One of the things that we found was some of these topics, for example, the need for cultural gathering spaces was really high on the priority list. One of the things that we went through was to think about what are some of the indicators or data variables that we would need to look for in order for us to provide data that would be useful to this need that our community has asked of us. So that was one process. That was fun. Following that, we then pivoted to actually developing the tools. And there were a few tools that we developed through this process. One of them, of course, is what Calvin has provided you here, is the dashboard. Following our data compilation or sources compilation process, Calvin and his data team began to build the dashboard, scraping data from different sources. And then we had a beta version of the dashboard that we provided to the community to gather feedback. This is also really important to us to make sure that we were presenting information to our community through the dashboard that would be useful to them. We actually went through 2 feedback processes for our community. The first round, we gathered the information, the data team then improved the dashboard, added more data to it, and then we went through a second round of feedback from the community. And we found this really useful and also really validating to some of the features that was being put into the dashboard. The other tool that we are developing still is we wanted to provide data profiles. We understand that some of our community organizations need this kind of information in their hands to do work such as policy advocacy, or when they meet with funders, they can give them a one-sheeter that has the data about our community. We are in the process of developing data profiles for the top 10 California counties with the top 10 NHPI populations. And we will make that available shortly. But this is kind of what it looks like. This is the template that we had created and gathered feedback from the community on. And this will be available for the top 10 California counties. Lastly, the other tool that we are currently developing is a training curriculum. And this is to specifically help build data capacity for our organizations, and not just our community-based organizations, but other agencies that work with our community, such as county agencies, state-level agencies, researchers, to help them be familiar with our community and what their needs are, and maybe even have some exchanged learning in the process. Our data capacity training curriculum is broken up into these 3 key modules, and the information that is built into the curriculum was gathered from the community needs assessment. The first module is really looking at finding, interpreting, and understanding data. The second is on navigating data dashboard, and this will help, we will use our data dashboards that Calvin presented to help feature ways that you can capture data from different dashboards. And then lastly, how you can use that data for impact. So ways to use data in policy development, narrative building, and most importantly, and this came through in our needs assessment, in seeking grants and resources to support our organizations and sustain them. And lastly, part of our process is to, of course, disseminate these tools, because there's no use for data if it's not being used by the community, especially that needs it. So our event today is one of our dissemination activities, but also we meet, we meet with our organizations one-on-one sometimes when they need technical assistance with data. They know that they can reach out to us and ask for the data that they need. But, our inclusion of our community voices today as part of our launch is also part of the dissemination. We hope that in any work that we do, that we continue to uplift the voices of our community. And part of that is our attempt at continuing to build data capacity for our organizations and to continue to engage and build community capacity. And so I'll close out my portion today by sharing a Tongan word, and this came up when our flyer came out with this beautiful hibiscus, and it reminded me of the word matala in Tongan, which means to bloom. It is also the root word for the Tongan word for to make clear or to explain, which is whakamatala. One of the most commonly used prefixes in our Tongan language is the word whaka, F-A-K-A, and it means to make. So when you put that prefix next to matala, which means to bloom, is the word is to make bloom. So the word for explaining or to create understanding is whakamatala. And all of what I've shared and what Calvin has shared isn't necessarily useful unless it makes clear for the community the ways that they can use data. And so I want to invite 2 of our community leaders who will be sharing the work that they're doing in community around building data capacity and the ways that they use data. And hopefully they will further explain, they will whakamatala to all of you why data is so important to our community and the ways that they contribute to building data capacity for our organization. So First up is Tupo Latu Kefu. Tupo is a community researcher and program coordinator for Pacifica Urban Roots, a program of the Samoan Community Development Center in San Francisco. Her roots rise from the Bay Area by way of San Bruno and the islands of Tonga from the villages of Haveluloto, Kolovai, and Nomuka Ha'apai. She has a bachelor's degree in ethnic studies from UC Berkeley, as well as an associate's degrees from the City College of San Francisco in communications, social behavioral sciences, and critical Pacific Islands and Oceania studies. She recently participated in the research team for Ka Pasafetu'u, a community needs assessment examining the needs, gaps, trends, and strengths of Native Hawaiians and Pacific Islander youth and families in San Francisco. Her main research interests are to learn and utilize Indigenous research practices to generate data that will elevate the voices and stories of the Pacific Islander community in the Bay Area. Following Tupo will be Ualani Ho'opai from Pacific Islander Health Partnership in Orange County. Ualani stepped into the executive director role at Pacific Islander Health Partnership in 2021 after serving as a volunteer at PIP in various capacities for the past 9 years. She is PIP's first executive director since it was founded in 2003. Ualani was born and raised in Honolulu, Hawaii, Maunalani Heights. She graduated from Kamehameha schools. She began her college journey at Fashion Institute of Technology, where she achieved her associates in fashion design, merchandising, then continued to Columbia College, where she obtained her BS in business administration with a minor in international business. Ualani received her MPH in health promotion and disease prevention from Cal State Fullerton, where her thesis focused on Kaleponi Pili Ohana, a partnership for improving lifestyle intervention in Pacific Islanders. She currently serves as the treasurer for Aina Hau o Kaleponi Hawaiian Civic Club in Orange County. Please welcome our first community speaker, Tupo Latu Kefu.
Okay, sorry, I'm really nervous. Hello, everyone. Si Otoofa kainga ofena ko hokuhingoa ko Tupo Latu Kefu. My name is Tupo Latu Kefu, and I am a program coordinator for Pacifica Urban Roots, which is a program of the Samoan Community Development Center, also known as SCDC. I'm really grateful for this opportunity to be here with all of you and to share a little bit about Ka Pasafetu'u, which is, like Alisi said, a community-led needs assessment that I had the privilege of participating in as a community researcher last year here in San Francisco. And so today I'll be going over some of the details of the assessment and highlight the ways we were able to build community interest in data and research. Next slide, please. Cool, so just to share a little bit of background, the name Ka Pasafetu'u is a Tongan name, which translates to star compass. The name was given to us by community leader Leafa Tamoepeao when we were strategizing on how to navigate our collective work in the community. And so we hold this work up as our compass for ourselves and for agencies serving NHPI youth and families. Next slide, please. And just to go over again, I know Alicia mentioned it, but when we came together to do this work, this was our first collective decision. The purpose of our research is to determine the needs, gaps, trends, and strengths of Native Hawaiian and Pacific Islander, or NHPI, youth in San Francisco. So we knew that the research was a priority, and we had a lot of conversations about the term NHPI, but also like what was the right focus and the language to use. And so we wanted to use a term that was one, recognizable to our community and to institutions who serve our community, and two, that acknowledges the diversity of our community. Another thing that we wanted to make sure we focused on in this work is that our research needs to not only identify the needs and the gaps of our youth today, but also to acknowledge their strengths. Next slide, please. Okay, so I just want to jump right into our research team, or our team of community researchers. All of these beautiful people are people from our community, and they also serve our community. The call was put out there for volunteers to do this research project, and to my surprise, people were really excited. Everyone in this photo had different levels of experience and access to data and research, but they didn't let it get in the way of them participating in what could potentially be something that brings our youth closer to accomplishing their goals. And so a nice thing about SCDC is that we are all about empowering our community. And so we were able to bring on Sarah Wangking Tanuvasa and Levalasi Loyan, who are two amazing Samoan women, amazing educators, and amazing mothers to help lead this project. And, we could have, just hired on a team from Stanford or UCSF or even a third party, but we knew that we wanted this research to be done by us and for us. And, I really love looking at this picture because you take one look at it and you can see that this whole team of researchers is made up of Pasifika people or Pacific Islanders. And like any other group of people, our dynamics did change over time for many different reasons, but every single person in this photo made a contribution to this research project. And we were just a group of people who didn't feel qualified to do research, but we sacrificed our time to learn how to do the research while managing all of our other work and responsibilities. And so what does that say about data and research, right? Like, what does that say about our community and our people? It says that data and research are not accessible, and it says that data and research can be scary sometimes, because of the academic jargon and the confusing bar charts. But our people, our community, are interested in empowering themselves and the youth today in whatever way that they can. Our community today is ready to take on the challenges that have been guarded by barriers of racism and inequity. And so, with all that said, how did we prepare ourselves? On the slide, I just have the topics that we covered in our training sessions. We talked about telling our stories, program planning, the what and why of community needs assessments, research planning, methodologies, self and community care, and analysis. And I want to stress that it took an entire village to not only get us through this process together, but to be able to deliver our community's stories and data in the most intentional way possible. Next slide, please. And so how did we gather those stories? What was our methodology? How are we going to go out into the community and collect data? And that answer is through our ancestral and cultural practices that we know and we love and are familiar with because we use it on a daily basis. And that is through storytelling. We used indigenous methods, which are ways to do research that weave in indigenous cultural practices, protocols, and values. And I just want to read the quote on the slide really quickly by Dr. Timote Violetti. There is a danger in assuming that all Western, Eastern, and Pacific knowledges have the same origins and constructions so that the same instruments may be used for collecting and analyzing data and constructing new knowledge. What he's basically saying is that we can't just do research any old way, because our communities have our own ways. We have our own knowledges and practices. So we decided to do a mixed method approach with using talanoa for the youth and community leaders, because we knew our youth today, they're eager to tell their stories. And so we wanted to share space with them and give them room to speak openly and freely about their experiences. We also used elements of the Fa'afale methodology to have one-on-one conversations with parents and caretakers. And we did it this way because we also wanted to honor families' privacies. We also wanted to recognize that not all youth feel comfortable in a group setting. So we utilized surveys to make sure that their stories were not left out. And in doing all of this, we are tailing the va. We are doing our due diligence to tauhi the va, or the space, right? Like the relationships between us as community workers and the community. And with that, people were able to open up and share their truths in the ways that they know how. And we were able to help them feel validated that their stories carry value and that their stories and histories are worth celebrating. Next slide, please. Through those methodologies, we were able to gather stories from 365 community members. 217 of them were from the youth and young adults. Sorry, I just get emotional talking about when talking about our folks. 105 of them were parents and caregivers, and 43 were community leaders and service providers. And so in the spirit of Tauhiva or Teoleva, we made sure that each participant who completed a survey or talanoa left with a gift. For those of you who may not be familiar, a big element of doing or being in a talanoa space is reciprocity. There is a cultural exchange that happens in a talanoa space. And since myself and the community researchers were limited on joining in the exchanging of stories, we decided to share gifts. And you know, I'll speak for myself. I also don't think that we should be asking the community for their cultural currency without anything in return. And so we prepared swag bags for the community leaders and offered gift cards to the youth and the parents/caregivers. Next slide, please. So this is just a look at our timeline for the whole process, and it definitely looks similar to the process that Alisi and the NHPI Data Policy Lab went through. I won't go over everything, but we did start this process in October 2021, and in September 2022, we completed our research and we're ready to report back to our community the data and the story that the data tells about our youth today. And so moving forward, implementation for SCDC and Pasifika Urban Roots looks like getting the report in the hands of people who can create change for us, right? Like city officials, school board members. We were actually able to get the report to a commissioner who brought up the report in a board meeting, and she spoke to the needs of our NHPI youth. Like that is that's a little win for us. And implementation also looks like us utilizing the report to improve existing programming and developing new programs that will cater to the needs of our youth. And so, yeah, this process was super long. And I bet you're wondering, like, how were we able to keep our community folks who are a part of the process engaged during this lengthy process? And so I just wanted to highlight a few things. Some components are one, each of the trainings were facilitated by amazing women from the community who understand critical pedagogy and different learning styles. And so they were able to cater each of the sessions to meet the access needs of everyone in the research team. Two, we had support. We had a lot of support from the community. Once folks knew that their family members or people that they knew from the community were the ones doing the research, people were like ready and open to share their stories. And it was their stories that helped keep us motivated in this process. And then the last component I want to highlight is food. is food. We made sure to feed our research team every time we met up. It's just a cultural protocol that we take care of ourselves. So having food, having music, laughing, right? Those are all things that we utilized in the space to care for each other. So yeah, emphasis on the food because we ate good. Next slide, please. Okay, and so I'm jumping straight to our community report back. When planning for the Kapa sa Fetu'u report back event, we wanted to make sure that we were able to present the data in a way that wasn't boring and that didn't feel intimidating. So we found ways to incorporate Pacific Islander businesses in this event because, you know, when we say we're all about empowering our community, we also want to practice it. We had performances from our youth program, Pacific Islander Youth Alliance, or PIYA. We also had a local Samoan rap artist from San Francisco, shout out Hi Guy Lai, as well as a live art performance by Tracy Williams, who is a dope Tongan artist and is now the creative arts educator here at SCDC. So bringing us back to the cultural practice of Tauhiva or Televa. We also prepared swag bags for the attendees, which also included items from Pacific Islander-owned businesses as well. And to make it fun, make it even more fun for the youth, we had raffle prizes like PS5, iPad, all the fancy stuff. And so while all of these things were to entice like our folks to come and join us at the event, to my surprise, people were genuinely interested in learning about the report and how the report will impact our community. We had over 300 people in attendance that night. This photo right here, it really doesn't do our event justice because the people all the way in the front are literally like looking up right at us because there was literally no room in the back. But the people who came through were like our youth, our young adults, community leaders, even folks from city agencies like DCYF and the school district. We went over time, so we weren't able to take all of the questions, but it was so dope to know that our people came ready with questions. And so that says to me that our community is interested. Our community is interested in what's going on in our community on that level, as well as like on a political level. What that also says to me is that it's really all about the approach and the care, the space that we nurture together and for our community in our cultural ways where they can access research and data for themselves and for, you know, their generations to come. And yes, that is the way that I see we can raise or build community interest in data and research. Next slide, please. Okay, yes, this is it for my portion of the presentation. Thank you guys. I have my information here if anyone is interested in learning more about the process or our recommendations and findings. I also have the link for our full report. Mala'opito tua fatu.
Congratulations to Po and the village that put that all together. What a wonderful, wonderful project and presentation. So aloha mai, my name is Uolani Ho'opai, and I'm here today as the Executive Director representing Pacific Islander Health Partnership, a nonprofit based in the city of Santa Ana, which is located in the heart of Orange County. This year, Pacific Islander Health Partnership is celebrating 20 years of service to the Native Hawaiian and Pacific Islander community that predominantly reside in Southern California. We're focused on the Chamorro, Marshallese, Native Hawaiian, Samoan, and Tongan populations, and PIP board members and PINs, which are equivalent. Our PINs are Pacific Island navigators and are equivalent to community health workers, come from and represent each of these communities culturally, in practice, and in language. Next slide, please. So I want to just say a big mahalo nui loa to the Native Hawaiian and Pacific Islander Data Policy Lab at the UCLA Center for Health Policy Research for this invitation and the opportunity to share why it's important to us and why accessible data matters. And for the brief time we are here together today, I just would like to share a few points of interest. One being who Pacific Islander Health Partnership is, why data is important, and why accessibility matters. Next slide, please. So for those of you who are not familiar with Pacific Islander Health Partnership, we were founded by a wonderful couple who had a vision, founded by Jane Ka'ala Kahikina Pang and Victor Ka'ivi Pang. I believe Auntie Ka'ala might be on the call today. I think I saw her name pop up. So we are forever indebted to her for having the vision, to her and Uncle Ka'ivi for having the vision and the need to convene our folks and lay the groundwork for much of this work that we're doing today. So we're based in Garden Grove, and we are officially established in 2003 and granted our 501c3 nonprofit status in 2005. And the populations of focus again are the Chamorro, Native Hawaiian, Marshallese, Samoan, and Tongan. And we're rooted in strong traditional cultural values of aloha, kokua, kuleana, ma'alama, and lo'okahi. And we do have special programs as well that we focus on our kupuna and our opio. Next slide, please. So also wanted to share our network of how Pacific Islander Health Partnership is set up as a convener. So we have groups that are community-based, grassroots, cultural groups, as well as other nonprofits. And again, having the vision to bring us together so that we could work collectively as a Pacific Islander unit for different projects, be it health, be it advocacy, and a number of other things. But that was the original vision. So the groups that we have as part of our network are the Katurin Chamorro Foundation, Marshallese Youth of Orange County, Ainahao Kaleponi Hawaiian Civic Club, Lingafa, Samoa Matalasi, the Young Samoa, Family Petaha are the organizations that are currently part of the network that we're doing and the work that we're doing in community. Next slide, please. And so just wanted to spend a quick moment to talk about importance and how we as PIP have used some of the data in the past. I just want to quickly share, this has been a Bible for us, Community of Contrasts. And this is the California version that's dated 2014. And there was also an Orange County version. And that's what we had been living off of as information. So I'm so excited that these dashboards are now available and that we'll have updated current information for which we can pull from. So looking at that process, we look at the descriptive portion, right? When we're looking at data and looking back at the history of where things have come from and where things have started. And so I'll tell a story at the end with regards to how that was important to us, but descriptive covers our historical pieces, right? And what happened and what we're looking at to try to tell our story. And then secondly, our diagnostic piece, again, looking at historical perspective, but we also start to look now at trends and patterns that have occurred so that we can try to pull these pieces all together to build our story. Because data is important and it enables us to contribute to telling a fuller, more richer, robust storyline. And then with these two pieces in place, now we can start to look forward, right? Because we've been looking back to the past, which you always do, because we always want to look at all those that came before and all the activity that came before. And now we start to look ahead and start to build upon that and try to predict some of our potential outcomes that lay ahead. And then after that, we can start, after those 3 stages have happened, we can start to maybe even make some recommendations of how we can take action and make some decisions and start streamlining our process. So just taking us through that process of how we have used data in the past. Next slide, please. So when in regards to accessibility to data and why that matters is I'm so excited as Calvin had shared and Alisi both had shared previously, with the creation of these dashboards now, they've removed a lot of the barriers that we've had in the past when we were trying to collect information. So now we no longer have to worry about, you know, any special degrees or certifications, any technical pieces that are required for that, any special equipment that would be required. A lot of universities use statistical programming for SAS and SPSS and these other programs that require annual subscriptions to be a part of. And again, so now, thankfully, with these dashboards, we have the information in one place that is easily available, and the complexity has been taken away from that formula now. So now we don't have to worry about hidden portals, any obscure formats, the inconsistency in columns, the types, the headers, all those things that made it difficult to find information and time consuming. And so now it's much more user friendly. And so as Calvin mentioned as well, right now, the goal of this was to minimize the number of clicks in order to get to the answers that you're looking for. And so making the site easy to navigate, the dashboards easy to navigate and straightforward with the information. So next slide, please. And what this all comes down to for us, right, is now we can tell bigger, better stories for our funders, for our donors, because funding is key to what many of us on the call here today do. We're writing grants constantly and having to always consider that information. And in many of those perspectives from the donor, from the funder, from the elected official, if there's no data, you don't exist, or there's no problem out there. So this way we're able to highlight the diversity. And without it, right, we would be missing out on research agendas, on scientific advancements. We'd be missing out on a whole lot more without this. So I'm again, I can't say often enough how excited I am about having these dashboards now ready at my fingertips. And same goes for resource allocation that leads to more equitable distribution of funding programs and services. And the interesting thing for PIP, we said, you know, we get funding from outside sources, and we also are funders to our network. So we look at it from both sides and are affected both ways, upstream and downstream for our activity. So funding is key, where data plays an important role. And the effect is a chain reaction, right? So without the funding, we can't provide service, we can't fulfill community requests and community needs. And ultimately, without that support, we would possibly need to consider shutting down and closing our doors. And unfortunately, over the last decade, there have been a number of Pacific Islander organizations who have had to do that. COVID has brought up, you know, some new ones, but, you know, we're sad that some had to close, and it was a matter of funding and sustainability and capacity and all of those pieces that we're trying to build here today. So want to just always keep that in mind. And then when we talk about the advocacy piece, again, no data, we don't exist, then there's no problem. Without the current relevant data, we're unable to inform policy and tell our full story. When it comes to the elected officials, sharing that information is key. And our NHPI communities have faced numerous health challenges that include disproportionate high rates of heart disease, cancer, and you couple in with that difficulty accessing and navigating the fragmented healthcare system, safety net services, and the inadequate support for health workforce participation, these disparities are exacerbated during the COVID-19 pandemic, which saw the Native Hawaiian and Pacific Islander community suffer from the highest case and death rates of any racial and ethnic group in California, according to the California Department of Public Health. And so this is so crucial to the work that we do and the work that we're going to do moving forward and building our capacity. And the one story that I wanted to spend a little bit more time sharing with you is an example of how that came into play with PIP. We had the opportunity early on in the pandemic that our community, with the devastation that it was having, had the opportunity to talk to high-ranking officials at the healthcare agency here in Orange County. And we were able to share with them that the mandates that came down for the age threshold. So to start with, when the vaccinations were rolled out in January of 2021, was that you had to be, of course, immunocompromised was a part of the formula already, but if you didn't have any of those issues, that 75 years or older was the population that could get vaccinated. Well, we shared that, we have groups, populations within our base, within our Pacific Islander community, that their life expectancy is not 75, and for some it's 65. And so having that threshold at 75, you're excluding us from this formula, and we're the ones that are most impacted. So how can we, what can be done to try to alleviate that? And thankfully they were listening, and they were willing to work with us. And so they allowed us to bring in our people earlier on. So we were able to get our elders in earlier on that were the 50s and 60s that were really ready, willing to get their vaccinations. And so we are so grateful for that. And then we took it one step further and actually did a couple events, open clinics for our religious leaders. And so our religious leaders were in the 30, 40, 50 range, but we knew the importance of them getting vaccinated early on as being the influencers in their circles, in their communities, and their churches. So they worked with us on that. And so we had a couple events that were focused just on our religious leaders. And we actually had, because again, this was such an unknown scenario for so many of us, we had people that were asking to come and actually came from Arizona, from Utah, from Oregon, because they wanted to be with their community in going through this process of getting their first vaccinations. So we're super grateful that the healthcare agency was willing to work, but it was, again, because of having data to show these scenarios that we're being impacted by, helped to change policy, and we were able to get some exceptions. So again, I cannot say enough how excited I am, and I know many of us here on the call today are, that these dashboards are going to be at our fingertips. So mahalo, mahalo again. And I hand it now over to Tiffany. So the one more slide, and it's my thank you to everyone. Mahalo nui loa.
Thank you so much. What a wonderful presentation from everyone here today. I don't know if folks have been checking the chat, but I think everyone is so excited about the work you're all doing. And just, thank you so much to everyone for being here today. My name is Tiffany Lopes. I'm the communications director here at the UCLA Center for Health Policy Research. I'm going to be going through the audience questions. So if you have questions, please use the Q&A function in Zoom. You can try using the chat, but there's a lot going on in there right now, so I might not catch it. You can also, if you'd like, use the raise hand function, and we can get some questions answered. So I just asked the presenters to turn their video on, and let's get started with the first question. Aloha, how do you respect data sovereignty in deciding who has access to the data that you create? And how do you communicate to the Pacific that helps provide this data? This is for any and all groups that would be open to share their manoa on this.
I would like to take a stab at that. So currently our data tools only use publicly available sources, and we're actually very careful about maintaining that line in the sand, because what we would like to do is find a way to support community organizations that are interested in protecting whatever data that they collect. And it's a disturbing trend to see that data is becoming so commodified that even our indigenous communities, and my understanding is that potentially Native Hawaiian speakers and Maori have had Native speakers and their voice recordings used for commercial purposes, with that not having been the original intent of their contributions. And so we definitely need to look a bit further into frameworks that can support the protection of that data. It gets complicated from a legal perspective because so many indigenous data sovereignty frameworks rely on federal recognition or official recognition from governments. But just speaking as an attorney myself, I think that there are alternatives that are worth looking into in terms of how perhaps this data could be licensed and how people who abuse those licenses can be held accountable. But that's something that we need to do a bit more research on our end to figure out how we can best support those efforts.
Thank you, Calvin. Is there anyone else that would like to add anything to that? All right. The next question. How can health plans support your work? And in what ways can health plans across California use this data?
I can start on that one, Tiffany, if that's okay.
Yeah.
And first of all, I just want to thank Alici and Calvin and Tupoi and Tuolani for just sharing all of their love for the community. It was really demonstrated today. So I wanted to thank you. And how the NHPI Data Policy Lab has had such an impact, as we've heard, to communities, but also in academic research infrastructure such as ours here at the UCLA Center for Health Policy Research. So thank you. I also want to acknowledge that Michelle Brown is in the audience. I think she's in our room, our Zoom room, who is our just supportive, caring project officer at the Office of Minority Health. So I wanted to thank you. I think what health plans could do to support the work is, like, one example, besides funding, as Iwalani said, is to, similar to what Calvin had shown in Kaiser data, is looking at your claims data, your EHR data, what other data sources that you have. And first and foremost is making sure that Native Hawaiians and Pacific Islanders are coded separately in the data, that they are visible in the coding of race and ethnicity, and that with by putting several years of data, that there can be enough samples so that we can overcome disclosure risk, overcome some of the statistical reliability that I'm sure many of you have heard and have been frustrated about, but that it's something that they just have to thoughtfully and mindfully, intentionally start thinking about their data resources to speak to the experience of all populations, and especially the smaller populations that are typically invisible when we see anything. So that's the first thing, is code NHPI separately from Asians. And then the other piece is also really look at the multiracial category. So that's one piece too. And we can talk about that because that's something larger, but that's the first. The second is, how can health plans help insights on the Native Hawaiian Pacific Islanders community is to, you have community benefits, I'm sure, or you have hospital systems in your health plans. And with community benefits, which is part of the Affordable Care Act, that you have to show what I'm hearing is MANA, community benefits to community. So why don't you use that tax exemption to fund, initiatives such as this and to fund community organizations? So that's my suggestion. Alicia or Calvin or Uolani or Tupo, you may have some suggestions too.
All right, there's some couple more questions. So again, if anybody has any, please feel free to raise your hand or drop a question in the Q&A. For the data sources you used, did you have to pay to download and access the data? And did you encounter any barriers in accessing the data needed for analysis on the dashboard?
We haven't had to pay for any of our data sources yet because they are publicly available. Unfortunately, for a lot of our community organizations, sometimes the data is most easily accessible through an API, which may require accessing through some programming languages. And that's the type of technical assistance and expertise that our lab hopes to continue to provide. But that level of expertise can also be a barrier even for these publicly available data sources. But these data sources currently, my understanding, are freely available. They're just relatively difficult to access. In terms of barriers in accessing the data, the largest barriers that I think we've faced so far has been relatively small sample sizes in surveys and some of the suppression rules that unfortunately are very inflexible. And we hope to have discussions with some of the agencies like we've had during COVID-19 to see if they might be willing to consider how small our community is, but how important the data is to us. If they might consider oversampling in the future or adjusting their suppression formulas so that we might be able to access a bit more data.
Thank you, Calvin. Is there anything else that anybody wanted to add on that question? No?
I think Alicia is. So.
Those are actually all of the questions we have. So if anybody has any last minute questions, feel free to go ahead and drop them. Oh, here's one. Are there opportunities or entities, federal agencies, foundations, academic institutions, et cetera, out there to financially support partner with the NHPI Data Policy Lab? Great question.
Was that Tana? Just kidding.
Yes.
Oh, it was?
Oh, yeah, that's there are a lot of opportunities. The lab is 3 years old, as I said in the beginning, but in some ways we're a startup and we're trying to make sure, and as Michelle Brown knows, who's here, of coming up with a sustainability plan. And so we're hoping that the product of the lab continues. It started with, again, the crisis of COVID. And yes, the high death rates were, they were from the California Department of Public Health, but they weren't necessarily featured. I think that was our claim to the lab, looking at that and then seeing, is this the pattern for other states? And maybe we should show which states collect. So it started out as volunteer. It was a labor of love. And I hope it doesn't, I hope it continues to be sustained. So there are opportunities for private sector, for public sector, academic institutions. I mean, certainly I have commitment from UCLA, from Center for Health Policy Research, to do our best possible to sustain the lab.
Thank you, Ninez. Somebody also asked too, going off of that question, is the lab a 501c3, for example, annual giving campaigns?
We are not a 501c3. We're under, it's under the UCLA Center for Health Policy Research. There is an academic entity right now. It doesn't mean that, that could be the evolution of the lab after, but right now we are not it's not a nonprofit organization. It's under an academic institution.
How can we help others to discontinue using the umbrella term AAPI? As of 1997, OMB 15, AAPI is no longer appropriate or supposed to be used, and I would argue that its use sadly perpetuates aggregation.
I am very glad this person asked. The Office of Management and Budget is actually currently studying proposals to update their categories and strengthen the language that would mandate not just the separation of Asian American Pacific Islanders as a data category, but also to mandate the collection of detailed categories such as Samoans, Tongans, Fijians, in addition to Chamorros, Native Hawaiians. And I think one of the most effective ways of advocating for that change would be to submit comments to the Office of Management and Budget, which is open right now to receiving letters on this. And the feedback that they receive will be taken into account when they decide how to strengthen OMB 15. And it's something that we hope can be decided on quickly enough in order for it to take effect for the 2030 decennial census, which seems like it's far away, but it's really not. A lot of these decisions have to be made years and years in advance. But responding to this Federal Register notice regarding these initial proposals, and I can share the links, is one way in which we hope to mobilize our community to let federal agencies know that we're done just asking even for just an NHPI category. We need to go even deeper than that, far more detail.
Thank you, Calvin. In terms of community engagement vis-a-vis data collection, how representative is the qualitative data from other NHPI groups from Micronesian and Melanesian community members who unfortunately do not have a lot of CBOs to cater to their specific needs?
I think I can answer that. It is the process that I'd shared about where we did our community needs assessment was focused on organizations. We recognize the fact that we don't have a lot of organizations that are serving some of our Micronesian communities, Melanesian communities. In those cases, we engaged informal groups that had participated in some of our work before. And so I think acknowledging is the first step, and then finding ways to engage community and build relationship is the next. And we know that in our work is predominantly, mainly Polynesian led and engaged organizations. We have to go outside of that. In the work that we did across the country to build the data policy platform, we also went outside of just formal organizations and asked the leaders that are in our network to refer us to other leaders that we don't know. And part of our commitment as the lab is to continue to build relationships with those leaders, whether they are part of formal organizations or not, because we know how important it is to engage them. We know that our issues are unique and our strategies also need to be unique to be able to address and work with those communities intentionally. So that's something we're committed to, and we continue to learn. And if there are folks in your network that we can engage in our work, please share them with us, and we'll do our part. Thanks.
Thank you so much, Elise. We have time for one more question. Are there any policies in the state legislative pipelines that would impact the work of the lab that we should be aware of?
I don't know, I can't think of anyone off the top of my head right now. I do know that the equity fund that the Asian and Pacific Islander legislators did in the state of California, the APILC caucus, where they were able to attain, I can't remember the exact number, but maybe it's over $150 million for, and some of that was allocated to AAPI data, about 10 million, to improve data insights, through surveys and qualitative data. That's one avenue that where the state has earmarked funds to improve data collection for the broader group. So I think that's one right now. And then Calvin and Elise, I actually first met them when they were advocating for the AHEAD Act, like AB 1726, and so that promoted more granular collection of NHPI data as well as Asian data. But I think that what we're waiting for is some traction on the implementation piece and of course the appropriations piece.
Thank you so much, Inez. So those are all the questions that we have for today. Somebody did ask about posting the link to the dashboards, so I just dropped those in the chat again. I'm also going to drop in the chat a link or an email address for you to email us if you are interested in receiving a copy of today's slides, or if you would like a recording, link to a recording. So thank you again so much to everyone, so much for joining us today. This was a wonderful event, and if you'd like to join our mailing list and learn more about the work the lab is doing, you can also email us at that email address. Thank you so much. Have a good day.